I got banned recently from @EmmyRobinDoula because I spoke out about the fact that she was saying things about obstetricians that simply weren't true. Sometimes it hits the fan in obstetrics and you've got to be ready to do an emergency cesarean section where you get 5 minutes to get the baby out before the baby is brain damaged. Cord prolapse, placental abruption, uterine dehiscence. We have no time in those situations. The reality is there are interventions that obstetricians engage in. We do use oxytocin when necessary. We will examine patients when necessary. We'll do membrane rupture. We'll monitor the fetus. And yes, of course, there are times where we have to do cesarean section. But are we doing too much? So in the posts from this individual, she claimed that there were way too many interventions. What were the interventions? One of them was changing the room from the entry at the hospital or triage to the actual room you labored in. That was considered an intervention, as though that somehow has some sort of impact on the birth of the child. Obviously, that has no impact on the birth of a child. So we do intervene when it's indicated in order to effect a safe delivery. And when I challenged her, she said, your scope of practice is to deliver babies through surgical means. And that's simply not the case. Obstetricians specialize in pregnancy. We specialize in the safe delivery of mothers and babies so that everyone has a positive and optimized outcome. Now, is it true that sometimes we have to intervene? Of course it is. We have to intervene, and we need to be the ones prepared to do that. Is physiological birth ideal? Of course it is. I support that 100%. I think women should try it when they can. But are obstetricians specifically only supposed to do surgical births? Of course not. That's absolutely ludicrous. We specialize in the safe delivery of moms and babies. And I will challenge anybody that says otherwise. And for those that are listening to people like @EmmyRobinDoula who actually believe that their doula training permits them to provide medical advice, you should not be providing medical advice to people about when to go to the hospital, where to deliver, how to deliver, whether or not physiological birth is better, or what an obstetrician's scope of practice is. A doula scope of practice has nothing to do with medical training, and there is no medical training in becoming a doula. So it's all based on staying in your lane, which she spoke about, except she didn't understand what her lane was.